We're really excited to hear from our speaker today, who will talk to us about the power of movement and how it can benefit you. We chose this topic because many multiple myeloma patients have asked us how they can safely stay active during and after treatment. With growing evidence showing that physical activity can improve quality of life, reduce fatigue, and support overall health, we wanted to bring you expert advice that you can trust. I met Vic after he responded to one of our post-event surveys. After talking with him for a bit, I knew he would be the perfect fit for this webinar. As I introduce him and we get a chance to hear from him today, I think you'll see why. Vic has 35 years of experience in business development, project planning and implementation, rehabilitation and wellness program, and operations management. He has dedicated his career to population health strategies and services that extend the quality of life of older adults through healthcare and WellCare initiatives. Vic holds a BA from DePaul University in sociology and an MS from the University of Illinois at Chicago in exercise physiology. He possesses several clinical certifications and has been a member and conference speaker for the American College of Sports Medicine, Medical Fitness Association, International Council on Active Aging, and Leading Age Illinois. Vic's passion to pursue certification as a cancer exercise specialist started when he was diagnosed in August of 2022 with multiple myeloma. After induction therapy, 2 stem cell transplants, and back surgery to support compression fractures in his thoracic spine, he found that the healthcare industry offered little guidance regarding exercise. He is now on a mission to support other cancer survivors on their journey to better quality of life. And with that, I will turn the time over to Vic.
Well, thank you, Cindy. I appreciate the warm welcome, and I certainly appreciate HealthTree sponsoring this webinar. And for all of those in attendance, obviously there's an interest in this subject matter, which is very encouraging to see. And so I hope that I will do justice to bringing you some new information and hopefully, if nothing else, to motivate you, patients you work with, caregivers that are with you to also want to participate in more of a structured exercise journey. So with that, I'll move forward. To give an overview, uh, just a quick overview. There we go. I wanted to start with the big picture perspective, a broad perspective, and then as we go through our conversation, to narrow it or target it down more specifically to different strategies, different techniques that I feel would be helpful in being able to serve our multiple myeloma population. So we'll start again just talking about the difference between physical activity and exercise. What are the general benefits for adults with regard to exercise? What are benefits for cancer survivors in general? And then go down to recommendations for exercise for cancer survivors, and then get more specific to considerations and precautions for multiple myeloma patients. And then, of course, some takeaways that hopefully will be very useful for you. I've also included quite a few resources and references to substantiate the different information that I'm providing to you. I think I have 14 resources and 20 references that I think will be very helpful. So if we move on, again, what's the difference between physical activity and exercise, and why does it even matter? Some of you might be thinking, oh, come on, man, you're just talking semantics here. Why do we have to even distinguish between the two? And the reason is it really depends on what your goals are and what you wish to accomplish. So physical activity is essentially, by definition, movement that expends energy. And that includes a whole host of things. Your day-to-day activities of shopping, it could be cleaning the house, doing laundry, preparing meals, and just doing your job, doing work. So all those would qualify for certainly physical activity, but how do we separate that from exercise? Exercise is planned, it's structured, and it's purposeful. And the reason why that those words are really very thoughtfully placed in there. Structured is very important. So, it can include things like walking and biking and swimming and rowing, all different types of exercises, resistance training that includes weights. It could be therabands, it could be tubing, even just your own body weight. So you can do resistance or strength training with no equipment at all. And that's the beauty of being able to be knowledgeable about what your options may be. Likewise, things like yoga and Tai Chi are excellent, not only for general activity, but they're wonderful, what I would call mindful movement. And by that, I mean it helps with your flexibility, with your range of motion, with your balance, and those are wonderful activities to help you become centered in your mind, which is so important when we're under stress for a variety of reasons, multiple myeloma just being one of them, of course. Exercise also has SMART goals. So let me define what we're talking about with SMART goals. It needs to be specific, meaning to say, let's focus on what you want to accomplish. Okay, let's have an end in mind so that it's going to ensure that you're going to achieve whatever that goal might be. Let's make sure it's measurable. So, how am I going to measure my progress? And there are a variety of ways to go about doing that, which we'll talk about. First and foremost, having a baseline is really helpful. Thirdly, is it achievable? So are my goals realistic? Am I really doable? Am I going from, you know, being able to walk to being able to run or to do, 10Ks and marathons and things of that nature? And in some cases, that may be the case. In others, you have to always start where you are in your journey. So that we'll talk more about. Is it relevant? In other words, why is the goal important to me? Is it because a doctor, a nurse, a physiologist, family member has said I should do that? Or is it something that's self-motivated? Is it something that's important to me and not just to someone else? Is it time bound? So do we have a realistic time frame for being able to reach that goal? Those are all important aspects, and we'll get into the details of that as we go a little bit further along. But establishing both short and long-term goals is really important. Again, if you're just, if you're just walking, saying, well, my first goal is going to be a marathon, that may not be the best approach. But there's different things that you can do, different shorter goals that you can establish, which will help you reach whatever that ultimate long-term goal might be. Again, why does it matter to separate the two? Without the SMART goals and a clear purpose in mind, you may never achieve the results that you're looking for. And, not being able to achieve that goal isn't the end of the world, but it can be very frustrating, right? And the last thing that we'd like to see is for you to become frustrated because you're not experiencing the progress that perhaps you were hoping for and decide to quit. You're much better off having short-term goals that are achievable, that you feel are doable, and that mean something to you. So taking those small bites are really important in order to be able to achieve that long-term goal, whatever it might be. I like to say that structure breeds habit and routine that makes exercise a part of your life. So we don't want to think about exercise as being something that I do when I've already done everything else that I have to do. In other words, is it something like, oh, when I have time, I'll get to exercise? If we take that approach towards exercise, I can guarantee you that 9 times out of 10, it won't happen. You want exercise to be a part of your daily routine, like brushing your teeth, like taking a shower. It's just something that you do automatically. And once it becomes a routine, I know that there are days when, gosh, I just don't feel like I didn't get a good night's sleep. There's something on my mind that's troubling me. It's okay to perhaps not do everything in your exercise routine that you normally would if you were feeling better. That's okay. But you don't want to skip a session if you can help it. And we'll talk about, what are those reasons and what certainly is important to do and to consider when you're looking at whether you continue to exercise or not. Again, the sooner you start to see positive results, the more motivated you'll be. And that's why it's small. It's important rather to take those small bites and to have very achievable routines in place that'll help you achieve the goal later on. Doing the right exercises the right way will definitely improve your quality of life. So, what are the general exercise benefits for all adults? Weight management, stress management, increasing your energy levels, improving your sleep, which we know is so critical and so important for us, increasing your endurance and your stamina to be able to do the things that you not only need to do, but the things that you also want to do, improving your focus, your concentration. I know it's very challenging to multitask for many people, including myself. And, the more treatment effects that take place, the more challenging that becomes. Having a positive attitude and outlook on life is absolutely essential, and it's absolutely something that I've experienced for myself, and many others have shared that same benefit from exercise. Increasing your strength, and we'll talk more about strength as we go along. There are more studies now to show that strength is vitally important, but power, which is movement or moving force over a period of time. So you're looking at your reaction time, which is what power is. So we'll talk about that. And then, of course, improving your ability to perform your daily activities. What are some of the exercise benefits for cancer survivors? Regaining and improving your physical function, your aerobic capacity. And when I say aerobic capacity, again, we're talking about your breathing, the strength of your heart, your ability to be able to walk upstairs, for example, to be able to go on those walks that you want to if you're not already doing those things. To exercise, it improves your strength, which is so important for your quality of life to be able to do the things that are day-to-day activities, but also to have the ability to do some things that you maybe hadn't even thought of before. To look at, can I hold my and carry my grandchild, when they're just little babies. There's a number of things that come into play when we talk about strength. And flexibility, of course, is so important because when you don't have good flexibility, you compensate. You compensate at other parts of your body, and those compensations will sometimes lead to injuries. So flexibility is extremely important, especially as we get older. Improving your body composition, and that really just means what's the ratio of muscle mass to fat in your body. So we're not looking at body composition as simply for cosmetic reasons. We're looking at it as the more muscle mass that your body has, it's metabolically active tissue, which means that it helps burn calories. It helps provide nutrients to the rest of your body. It acts as a very strong pump, if you will, similar in some respects to your heart. So having a greater amount of muscle mass is really helpful. And we're not talking about being, Arnold Schwarzenegger. We're talking about trying to maintain the muscle mass that we currently have, knowing the effects of some of the treatments that we have to undergo. Improving your cardiorespiratory endurance, endocrine function, neurologic, muscular, cognitive, psychosocial. There's a lot to unpack there, and we'll really get into the details of that as we go a little bit further along. Improving your ability to physically and psychologically withstand the anxiety, the stress regarding cancer treatment, the worry and concern about a reoccurrence or a secondary cancer that can result from it. All very legitimate, valid concerns. But the beauty of exercise is it helps us get to that calm state. It helps us to not only become stronger, it helps us to be able to cope with life's challenges that come along on a day-to-day basis. And so it's vitally important to potentially delay or reduce the recurrence or secondary cancer that can result. And I say potentially because while there are some preliminary studies that have shown that that is in fact something that can happen, we need more evidence. We need more studies. So more needs to be, investigated, and why it's so important that we have funding for research that goes on, particularly as it relates to multiple myeloma. Reducing long-term effects of cancer treatment as well as withstanding the current effects of treatment. It helps improve our quality of life. And the best one of all is there's no exercise treatment side effects. I can say from my own experience, I've said it from time to time that, you know, I don't know what's worse, multiple myeloma or the side effects of the treatment for multiple myeloma. Both can be very harsh, as we all know. And so, beauty of exercise is it's one of those gems where there is no side effects. And that's why it's so important. And I talk about it as exercise treatment. I am an advocate for making sure that exercise is a part of your treatment plan, whether you're still in the induction phase, whether you're right in the thick of going through stem cell transplants, CAR T. It's vitally important to continue to maintain some exercise, some physical activity. So, excuse me. So let's start with during treatment. Here, I've kind of broken this down a little bit. Um, and again, my references are in the back of the presentation today, which you'll all have access to these slides. But this is coming from Dr. Jay Harness and cancerfitness.org. Again, Dr. Harness is the chief medical officer with Maple Tree Cancer Alliance and is doing some wonderful work there at the Alliance. And I wanted to make sure that he, is duly noted for this information here. During treatment, it helps reduce the fatigue, helps you to get through those chemotherapy treatments. It helps you deal with the tiredness that we all struggle with. And you can't say enough, and I'll have more information about that. It helps you maintain muscle mass and strength. It helps prevent the muscle wasting or the cachexia due to inactivity or treatment side effects. One of the biggest things that I think is so important is when I talk about strengthening, for the most part, it's trying to maintain the muscle mass that we have. It's not even a matter of can we build more muscle, which is certainly possible, but it's maintaining what we have so that we don't have those deleterious effects of the muscle wasting, make it much more difficult for us to do what we need to do. Um, Improving your mood and mental health is so again important. Helps release endorphins that help with reducing anxiety, depression, stress. It enhances our cardiovascular health, and it counteracts the negative effect of treatments that can weaken the heart and blood vessels. It helps boost our immune function, which again is so critical based on the fact that we know we're all very susceptible to infection. Post-treatment, it helps reduce the recurrence of cancer. And again, something that we all have in the back of our minds, even when we're in remission, is to think, okay, when's that other shoe going to drop? This helps us build a fortress to help prevent that recurrence from happening. There is no guarantees, of course, but it's just so important. And the data supports the fact that it can reduce that recurrence risk. It helps improve bone health by doing weight-bearing exercises to help counteract the loss of bone density through the disease itself, or if you're going through hormone therapy. Those are really, really important aspects. And again, as Cindy mentioned, I can talk from experience with having compression fractures, that it's obviously very painful, but once you can reduce that risk level by doing weight-bearing activities that are safe and effective, it'll make a world of difference for your quality of life. It helps enhance cognitive function. And there's more and more research starting to look at this as it relates to exercise. That common chemo brain or chemo fog that we hear so much about, um, we know it's very real. And so, whatever we can do to help mitigate those changes is going to be extremely important. It helps regulate your body weight. And by supporting a healthy weight, it helps reduce inflammation and some of the hormonal balances that contribute to reoccurrences. From a cancer prevention standpoint, it helps lower the risk. And again, there's some examples here of breast, colon, lung, and endometrial cancers that the data has shown can reduce that risk level. It helps regulate your hormones, whether it's insulin, estrogen, or other hormones that are impacted by cancer. And also, it helps, as I mentioned a moment ago, it helps reduce some of the chronic inflammation, which has been linked through tests and research as one of the precursors for cancer. So, anything we can do to reduce inflammation is a good thing. So, what can exercise do? Here are some of the different results we found from doing the research. It helps prevent 7 common cancers: bladder, breast, colon, endometrial, esophageal, kidney, and stomach cancer. This is wonderful news to see this and to hear this. And I put the dose, and we talk about dose, it's really referring to what's the right combination of exercise that's going to produce that result to help prevent those types of cancers. Now, the research is showing for these 7 cancers, that doesn't mean it also can't prevent multiple myeloma from recurring again as well. This is just what we've gotten so far in our research studies. There's much, much more to come from there, I can guarantee you. So, what dosage was used to help prevent these 7 common cancers? 150 to 300 minutes per week of moderate exercise, that's moderate aerobic exercise, or 75 to 150 minutes per week of vigorous exercise. So again, when you break that down, you know, we want to hit that 150 minutes per week. We're only looking at 30 minutes a day, 5 days a week. I think that's doable for many people. And if it's not for you right now, it's something that you can work up towards. And we'll talk about how to get to that point. Also, it's by adding 2 sessions per week of strength training. And that strength training can just include your body weight. It could include equipment, supplies, machines, whatever you might have access to. As a matter of fact, just using your body weight is an excellent way to get your strength training in. Also, the research is showing that the survival of breast, colon, and prostate cancer has also been shown to occur by an exercise program. What does need to be stated here, though, is the exact dose of that exercises needed to reduce the cancer risk or all-cause mortality has yet to be determined. Um, the important thing here is simply that the aerobic exercise, the activity is important to help reduce your risk, but the research has not shown yet what that dose is. So it's not saying you shouldn't, it's saying that we haven't fine-tuned the recipe yet, if you will. And when we talk about dose, we'll talk about how it's quite similar when you look at your medication prescriptions. Cancer-related fatigue affects more than 80% of patients who are receiving chemotherapy or radiation therapy, while depression affects around 25% or so of patients. Unlike typical fatigue, it can linger. Depression can linger for months, even years after treatment. The good news is that moderate physical activity was linked to almost a 50% lower risk of cancer-related fatigue. And both moderate and vigorous physical activity were associated with a 2 to 5 fold reduced risk for depression. So again, this is coming from the American Association for Cancer Research, and it's wonderful news. This is really encouraging for everyone to be able to see this, to show that it's not just intuitive sense that exercise is good for you. We can actually show clinically that it makes a difference. Again, this is a schematic that is just indicating what we just looked at a few moments ago of at least 150 minutes a week of aerobic activity and 2 sessions per week of strength training. But what I think is really important, and the reason why I included this in this presentation, is that as a part of a weekly activity, multi-component exercise or multimodal, as terms will use, is really important. So including aerobic activity, muscle strengthening, as well as balance activities. We know that as we get older, the risk for falls increases. And the scariest part, as we all know, is when we're at risk for falls and we know that our bone density is not what it should be. And so we're at risk for fractures when we do fall. So anything we can do to help improve our balance as well as our strength is going to provide us with a good quality of life to help reduce our risk for injuries in the future. What are some of the barriers to exercise for cancer survivors? Um, well-documented fatigue, we just talked about. You know, I understand how it's easy to think like, oh my gosh, I'm so tired now going through treatment. How can I even think about starting an exercise program? And believe it or not, you can start exercise at any point in your treatment trajectory. Um, I was exercising when I went in for my 2 stem cell transplants in the hospital, and I was the only person out of 32 patients on my floor that used an exercise bike that was in the activity room for that oncology floor. And I say that not to pat myself on the back, but to simply say, what's wrong with this picture? Why is only one of 32 patients using that exercise bike? And so it really brought to mind the need for greater education and greater access to resources that would allow individuals to exercise, to understand the benefits of it. Pain, we know, is a big factor. I used to be an avid runner most of my life, and it wasn't until I experienced severe back pain and found out about my fractures that I realized and received my diagnosis of multiple myeloma. So it was through running, it was through back pain that came to light. But we know that that pain can continue on, whether it's fractures, lytic lesions, a variety of different pain elements. And so we can overcome that pain, understanding that if you have a fracture, of course, that needs to be addressed first and foremost, which is what I did. I had my kyphoplasty done to help strengthen those vertebrae in my spine. After that, then I knew I could start to exercise again. Again, fear is a really valid reason. It's, I'm afraid I could make my situation worse. Is exercise going to make my myeloma spread even further? Is it going to make my diagnosis or my prognosis even worse? So understanding that exercise again is really going to help strengthen you is super important to understanding how it can improve your quality of life. One of the other things is certainly the cost factor. Okay. Lack of insurance reimbursement for um, ongoing exercise programs is something that we need to be able to do as a healthcare industry to help support that. And how do we make that happen? That happens by more research studies showing very positive clinical outcomes from exercise programs, and that outcome data being shared with the government to help get reimbursement for these kinds of services that are so important to the health and well-being of myeloma patients. And then the other point I wanted to make is a lack of guidance from healthcare providers. One of the things that I found to be a bit, not a bit, but quite a bit disappointing and disheartening was the fact that I have two oncologists, like many of you I'm sure have. I have a general oncologist and I have a myeloma specialist. The myeloma specialist worked with me through my transplants, and I go to my general oncologist for my maintenance therapy. When I asked both of them, and I was kind of in the thick of treatment, and I asked both of them, I said, so what should I do with regard to exercise? The answer I got from both of them was the same. Well, walking's good for you. Why don't you try walking? And I thought to myself, is that all you have for me? Now that's, for talking to someone who's run marathons and 100-mile bike rides and, lifting weights and all this stuff prior to my diagnosis, I thought there's got to be more. And that was it. That was the only advice. They didn't refer me to any services. And so I thought, wow, there's really a gap here. And that's what also helped motivate me to want to do more. With once I became uh, a cancer exercise specialist. So lack of education regarding the science supporting exercise oncology is really an important factor. Many physicians, they're not aware of it. And let's face it, physicians don't go to med school to learn about exercise. So we can't expect them to be able to know, how to do exercise prescriptions or programming. They have plenty of other things that they have to impart upon us that's extremely important. But I would have hoped that they would have said to me, Vic, that's a good question. Um, I want you to talk to our nurse navigator. She has a whole list of resources that you can go to, whether it's a therapy clinic, whether it's a training center, whether it's a cancer wellness center, but a variety of different locations that can help you get on the right track as far as exercise. But that didn't happen. And so there's that void that needs to be filled. We understand that physicians and nurses, they're extremely busy. They're seeing patients all day. And so the time to promote and facilitate referrals can also be quite challenging, which is why we need to have exercise become a part of the whole treatment process. The statistic I have at the bottom of the slide, only 21% of Americans and 14% of newly diagnosed cancer patients exercise on a regular basis. That's a very sad statistic. And studies show that patients are more likely to exercise if their healthcare provider encourages them. So we as an industry need to be able to do better. We need to do more to encourage all of us, whether it's myeloma patients or any other cancer patients, to undergo a very robust exercise program. And again, it may start with just 15 minutes of walking a day and then progress from there. But you have to start where you at in your program. So here are some general exercise recommendations for cancer survivors. First and foremost, always consult with your physician, your oncologist for recommendations and restrictions prior to exercising. They know you better than anyone else. And so it's important that they provide their recommendations and restrictions for exercise first. And then the physical therapist, the exercise physiologist, can work with that as a starting point. Second, be clear on your goal or purpose with exercise, whether it's pain management, weight management, reducing treatment side effects, helping to maintain your independence, to be able to continue to work or play or do the things that you enjoy doing, whether it's golfing or shopping or whatever it might be, riding a bike. You is your goal to be able to, raise your kids or grandkids? Do you want to travel? Whatever it is, make sure it's important to you. Okay. Make sure that your goal is clear and it means something to you. Recommendations for general exercise recommendations, consider your current and past history with exercise. In other words, understand what are the tipping points, what's positive and negative for you, so that you're prepared mentally for what might hinder your progress. You might say, well, I've always exercised this way in the past. And so my question would be, okay, um, did that serve you well? Did you find it to be successful for you in continuing to exercise? And if the answer was no, well, then something's got to change. Make your intentions known to family and friends so they can help support your efforts. Don't don't operate in the vacuum. Don't isolate yourself at all. Always let your friends and family know they are so important to help you to be successful with exercise because they care about you and they want to see you healthy and well. Consult with a licensed physical therapist or a degreed and certified exercise physiologist. And that's important because you want to make sure that whoever you are speaking to about an exercise program, that they have experience working with cancer survivors, that they understand multiple myeloma, and they understand the risks and the benefits of exercise as it relates to your particular condition. Um, Adopt a schedule that allows you to exercise when your energy level is at the highest. For some people, it's at first thing in the morning. For others, it may be towards the end of the day, but you know your energy cycle. And so incorporate your exercise when your energy level is high. Exercise where it's safe and relatively convenient. One of the things I always advocate for is if it's at all possible, exercise outdoors. Exercising in nature is invigorating, it stimulates you, and it's also in some respects, it's a little bit of a diversion, it's a distraction. So you're not thinking so much about the exercise. You're enjoying being in the great outdoors. And wow, you're having a great time and you're gaining benefit from it as well. Consider what kind of supplies might be needed, if any, for your program. Always emphasizing hydrate before, during, and after your exercise. We really require so much water, and I'm really talking water, not those electrolyte drinks, not those other things that are on the market. Particularly again for multiple myeloma, because we know the work that it has and the harshness on our kidneys. And so hydrating is super important. If a particular exercise or movement hurts, stop immediately and let your therapist or your physiologist know. And engage in a well-rounded program. I guess we mentioned before, make sure there's some aerobic activity, some strength, some flexibility, some balance. So number one, you don't get bored. And number two, you have a good balance in your health and well-being, and you're not emphasizing one and sacrificing others. So if exercise is medicine, if you will, what's the prescription? The greatest gain with exercise is going from nothing to something. Okay. As long, you're always going to benefit by doing something rather than just sitting. And that's what the research also shows. That's where we see the largest relative reduction in risk for all-cause mortality and chronic disease. So doing something is always better than doing nothing. So again, looking at prescription, looking at exercise as being dosed like your medications. Um, if we take a look at what I have down here is simply your typical treatment phases for multiple myeloma, your induction phase, the start of your care. regardless of what you're on, if it's RVD or whatever the recipe that you're taking. Um, when it comes to your exercise programming, which I have in red, it's quite similar. You want to have an initial baseline fitness assessment so that you know what you're where you're starting, and you know then if you're making progress or not. Sometimes subtle changes, subtle improvements are not obvious to the person doing the exercise. It sometimes is helpful to record what's happening, to exercise with others, so sometimes they can give you some very good feedback. Oh, wow, you're moving a lot quicker today. You look like you're really moving with a lot better ease, things of that nature, but also understanding what your health and your exercise history is and having a consultation about that. So it's an introduction, what I call an introduction or induction, if you will, from a fitness standpoint. You have a baseline assessment. We need to know what your health history is, what your exercise history is, and consult and have a conversation about it. In the progression phase, again, whether you're going through CAR T, stem cell transplant, bispecific antibodies, it's adjusting that proper, what we call fit, the frequency, intensity, the timing, and the type of exercise based upon what you're going through in your treatment trajectory. It can all be adjusted and modified based on that. And then under maintenance therapy, right? Continuous therapy individualized for the patient and periodically assessed and updated based on your response and your change in goals. It's the same approach when it comes to your exercise prescription. Considerations for exercise. What stage of the disease process are you in? What are your comorbidities? What phase are you in your treatment, as we just talked about? What are your goals? Not just what are mine or what your doctor's goals are. What are your goals for your exercise? What's your exercise history like? What are your exercise preferences like? If I say that, hey, riding a bike is great for you, it'll help a lot, and you tell me I hate riding a bike, well, then we need to look at an alternative, right? We need to make sure it's something that you can enjoy. And then, of course, any access to equipment and facilities that may be necessary. Some of the cancer survivor health related recommendations for exercise, and this came from the American College of Sports Medicine. This is also supported by the CDC and World Health Organization, but based upon different aspects. So, cancer related fatigue, 3 times a week for 30 minutes per session of moderate aerobic exercise, and 2 times a week of resistance training. That resistance training would include 2 sets of 12 to 15 repetitions for all your major muscle groups. And then, of course, we have health related quality of life, 2 to 3 times per week, 20 to 30 minutes per session of moderate aerobic activity, plus the 2 times per week of resistance training, 2 sets of 8 to 15 repetitions for, again, all your major muscle groups. And so you're starting to see a pattern here. They all typically are 2 to 3 times per week, per session, excuse me, 2 to 3 times per week for 20 to 40 minutes or 20 to 30 minutes per session of moderate exercise for aerobic activity, 2 to 3 times per week for resistance training. It can vary the number of repetitions, anywhere between 8 to 15 repetitions. For anxiety and depression, again, 2 to 3 times per week for 20 to 40 minutes, etc. So again, there are strong recommendations and exercise prescriptions that can happen for depending upon what your needs might be. With regard to bone health, we'll talk about that in just a moment here. Again, 2 to 3 times per week of resistance training, including weight bearing as well as non-weight bearing exercises. Um, there is insufficient evidence to provide specific recommendations for aerobic exercise, but that's not to say that you should not do aerobic exercise. The science and the data just haven't been able to, if you will, come up with the precise fine tuning to say how much. Okay. So again, extremely important. Again, bone health. This is considerations and precautions for multiple myeloma patients specifically. To help with bone health, exercise helps, um, or I should say, excuse me, the decreased bone density that comes with multiple myeloma you're much more susceptible to fractures, as we talked about. So you want to avoid high impact exercises that might increase your fracture risk, such as running, jumping rope, high intensity types of some aerobic classes. Instead, consider walking, consider cycling, swimming, aquatic classes, using an elliptical, stair climbing, and that doesn't have to be a stair climbing machine. It could be stair climbing in your own home. Strength training, using your own body weight, using light dumbbells or machines. Weight bearing exercises increase bone density. And that really is the bottom line is you're much better off to do weight bearing, whether it's standing, walking, etc., um, than doing something that is sitting, such as, let's say, a recumbent bike or a new step. Those are all good exercises, but I would definitely combine it with weight bearing activity as well. So, infection, we know that we're all more susceptible to infection based on lower plasma cell volume in our bodies. So we need to make sure that we want to choose clean and controlled environments as much as possible, whether it means exercising at home, exercising at a gym, just making sure, again, you're using some of those basic kind of common sense things, using the sanitary wipes to clean off equipment, using a face mask, etc. Um, Hydration, we talked about, extremely important for peripheral neuropathy, choosing stable, low impact activities. If you're experiencing any kind of neuropathy in your extremities, that's why including balance training is so important to your program. It helps reduce the risk for falls and fractures. Fatigue, again, we want to um, reduce the fatigue factor because exercise can increase blood flow, increases nutrients and oxygenation of tissues in the rest of your body. That actually helps promote energy production. So it may seem counterintuitive to say, well, if I'm already tired, how is exercise going to make me less tired? Actually, once you complete your exercise, you are going to feel better. You still need to make sure you have time to rest. Give yourself that time to rest, and then you're going to find that energy level has been produced through the stimulation of exercise. More considerations and precautions. Again, treatment plan demands um, take that into consideration, working with your doctor to make sure that if we need to cut back a little bit on exercise, it's not to say you have to stop exercise necessarily, but modifications can always be made. Exercise progress is like myeloma, as I say, it ebbs and flows. There's good days and bad days. Um, don't don't give up is really the bottom line. Continue to work on it, adjust your program. Maybe you're not exercising quite as much on a day you're not feeling well, but you're still doing something. And the something is important to maintain a routine. Any changes or symptoms in your treatment plan should factor into your exercise. Again, there is gain without pain. You don't need to have pain in order to make improvement or progress. As a matter of fact, discomfort, especially if you haven't exercised in a while, is understandable, but it should not be painful. Listen to your body, inform your healthcare provider of any new symptoms. Again, we talked about infection control. Feed your body healthy foods. Don't skip meals, eat smaller portions, but more frequently. I would talk about hydration, minimize the sugar, the alcohol, the caffeine, which actually act as diuretics, and it's counterproductive to your hydration. And avoid forward bending and lifting weight above your head. Um, the reason for that is that it puts an undue amount of pressure on your spinal column. And for those of you who had herniated disc, you know that the herniation goes posterior or backwards. So forward flexion is not recommended. There's no need to do it. If you need to pick something up off the floor, you use your knees, you use your leg muscles, and you come straight down with your torso. You don't bend forward, you come straight down. You don't want to lift weight above your head. You can reach above your head, for example, to get things out of a cabinet, out of a shelf, but don't lift weight above your head. It puts undue pressure on your spinal column. Some of the quick takeaways. I know we're out of time here, so physical activity and exercise is beneficial for everyone. We know that by now, and any movement is better than sitting. So the important things are be clear on your goals and your purpose with exercise. Start with the end in mind. Your motivation will be your why. If you have those days where you're like, oh gosh, I really don't feel like doing this today, then go back to why am I doing this? And that usually will bring you back to, okay, I'm going to get through it. I'm going to do it because I know I'm going to feel better afterwards. Always consult with your doctor for activity recommendations and restrictions. And for specific exercise guidance and training, consult with your physical therapist or degreed and certified physiologist. I can say that simply because I've been a physiologist for 35 years. And up until this past year, I can honestly say that I did not work with individuals who had cancer because I didn't have the knowledge base for how to work with them in a safe and effective way. I got that knowledge base and I feel so much more comfortable now. But my point being is that not every therapist, not every physiologist knows how to work with multiple myeloma or with cancer. There's many forms of cancer. So look for the individuals who have that specialized training to ensure that you're going to be on the right road to recovery. Whatever the exercise program you choose, make sure it's fun. What I mean by that is do it outdoors if you can. Listen to music while you're doing it. Some music that's stimulating, that's uplifting to you. It makes it a lot more fun. Do it with friends, do it with family members, okay? But make it fun so it's not work. Track your progress because subtle changes are not always obvious to you. So sometimes journaling your activities, using a calendar, using a fitness app is really, really a cool thing that you can do. And it's an easy way to track your progress. Consider exercise as only one part of your entire multidimensional wellness program. Think about the mind, body, spirit approach and think about what else can I do in addition to exercise that will help me to grow, that will give me a better quality of life. What I have here is several pages of resources. Um, I bring this on the screen because there's many, many organizations that do a wonderful job. HealthTree being certainly one of them, but there's many organizations that have wonderful information and guidelines for you. Two things I will point out very quickly. ACSM's Exercises Medicine Exceed Survey is an excellent tool. And these are all links that you can just click right on and get to that. It's a nice survey to identify based on your particular condition and your needs, where are locations that'll help meet those needs in terms of exercise providers. The directory, excuse me, the survey identifies your needs, but the directory, moving through cancer, is a whole list of providers based on where you live. And then we have several others, of course, here as well. And then several pages of references to support some of the information that we had today. So I want to thank you for your time. I know I went a little bit longer than I anticipated, but I'd certainly welcome any questions that you might have.
Perfect. Thank you so much, Vic. That was a lot of really great information. And I know everybody's going to appreciate getting those slides so that they can click on the links and get, more information. So thank you so much. Um, as Vic said, this is time for a Q&A. We've got just a few minutes. So if you do have a question, make sure you drop it in the Q&A at the bottom of the screen. So first question we have is, I try to routinely exercise every other day. Is that sufficient or should that be changed to daily?
The question that I would ask in response is, are you doing the same exercise each time? If you're doing the same exercise each time, I think that's a good start. But what I would consider is on those alternate days, do a different type of exercise. So, in other words, if you're doing aerobic activity Monday, Wednesday, Friday, on Tuesday, Thursdays, and Saturdays, do your strengthening routine. So you have a good balance between strength and aerobic.
Okay, thank you so much. Got another question just asking if pickleball is an option. Is that something that would be okay given a myeloma diagnosis?
Absolutely. But here's my qualifier in my response is simply to say, I wouldn't rely on pickleball as your only means of exercise. I think it's a great activity, stimulates, great balance, good hand-eye coordination, good cardiorespiratory. But make sure that in addition to your pickleball game, that you are doing some structured activities to help support your game, because I think that's going to make the difference. The thing that you don't want to do is if you're having, for example, balance issues, and you're at risk for falls, if you're like me and you're like, win at all costs, you're going to be flying around the court, and we don't want you to hurt yourself and suffer a fracture. So hopefully that makes sense. Support your pickleball game, which is wonderful, with some other additional activities when you're not playing.
Perfect. Thank you so much. Next question is just if you can you define what moderate exercise would look like? Is it an increase in a percentage of your heart
So
rate, or what is that?
yeah. No, there are formulas associated with that, but what I find to be the easiest thing for most people to relate to when we talk about moderate or vigorous exercise is think about a 1 to 10 scale. And that 1 to 10 scale is an exertion level scale. Okay. So moderate effort or moderate exercise in terms of intensity is we're looking at between 5 and 7, okay, as a moderate level. So, and that's very subjective on your part. Think about a 1 to 10 scale, 10 being like, oh my gosh, I can't do any more. I'm at my wit's end. And one is just a walk in the park. So if you're exercising between a 5 and a 7, that's moderate. That's where you can still hold a conversation, but you're not singing a song. Okay. So vigorous is anywhere from 7 and 8. Okay. You don't really want to be exercising above 8 on a regular basis. Okay. But if you're at that level, then that will you won't be able to hold much of a conversation. You'll be really moving pretty vigorously. So I hope that
Okay.
helps.
Absolutely. There's a lot of information in your slides about the moderate exercise, so I wanted to make sure we touched on that. That was perfect.
Sure.
Um, I've got a couple more questions here. We'll try to get to them. First, just says after 3 years of bone marrow and MRD negativity, I still not do not have energy, and I feel my body itching all the time. Any advice to help with that energy level?
It's tough. It is tough. I understand that. The thing that I would suggest is there's two things that I find in most people, and I believe this would be true in this case as well, is um, sleep, hydration, and more movement. Because even though it's oftentimes we don't sleep well, partly because of the medicine, but partly because we haven't exerted ourselves enough. We haven't done enough throughout the course of the day to get a good night's sleep. Okay. So we haven't tired ourselves enough in a good way. And so you're much better off to get a good night's sleep, which will help you have the energy and have less fatigue during the day, if you get an exercise session in. So I hope that makes sense to you because it's really important because exercise and the hydration, of course, too, is the more water that you drink, the more it feeds your muscles. Your muscles are about 60 to almost 70% water. So when you're dehydrated, you may not even know you're dehydrated. You could be in the middle of the winter and become dehydrated if you're not hydrating, drinking enough water. So try to incorporate those factors in as well. And I believe it really will make a difference in terms of your energy level.
Absolutely. I think it's hard. Our bodies seem to force us into some of this where once you exercise, you feel better, you're not as tired, but you also have to kind of battle against the tiredness to get to that point. So that's a tricky kind of conundrum.
Right. And there's nothing wrong with taking a nap during the day. That's that's what I've learned is, I used to feel bad about it at first. I'm like, nope, it's time for a nap, and I feel much better after I do. So,
Absolutely. All right, we've got a couple more questions, but we are right at time. So I will save these questions and see if I can get some answers for those two questions there. We want to, of course, thank you, Vic, for your time and for your expertise and for sharing your day with us. So thank you so much.
oh, thank you. It's been a pleasure, and I hope it's been helpful.
Absolutely. All
All
right, we'll
right.
go ahead and just clean out this session. As a quick note, as you leave the session today, we'd appreciate you taking the 2 to 3 minutes to fill out a brief survey about your experience during today's event. The survey will appear as a pop-up once you close out of Zoom. This helps us tailor our events towards topics that are most meaningful to you. On the screen, I have several of our upcoming events that I'd like to highlight. On Saturday, May 17th, we've got our Chicago Myeloma Roundtable. It's at the Chicago Marriott, and the day includes an informative and engaging presentation about the latest in myeloma, as well as breakout sessions for both newly diagnosed and relapsed refractory patients. Registration, parking, lunch, and refreshments are free. So if you're in the area, I highly recommend signing up for that. On Thursday, the 22nd of May, our Black myeloma health community will be learning about harnessing the immune system, understanding CAR T cell therapy for multiple myeloma. And then on Tuesday, June 3rd, we'll have our bi-monthly financial Q&A for all blood cancer patients. So we will have a link to sign up for all of these events sent in the follow-up email, or you can go find the registration page through healthtree.org. Before we leave, I wanted to highlight one more of our in-person events that we're really excited about, which is our Connect to Cures program. Our goal is to get into communities and share connections and resources. If you're in the cities listed on the slide, please consider joining us and spreading the word with those in your community. Our first event will be happening in just a few weeks in Macon, Georgia, quickly followed by Peoria, Illinois on June 7th. I have a QR code on the screen that you can scan to learn more and register. I'll also include this information in the follow-up email. I'd like to again thank our sponsors, Adaptive, Pfizer, Johnson & Johnson, Amgen, and GSK. And lastly, I want to thank you again for joining us today and for helping us build a strong multiple myeloma community. My email address is on the screen. I always love hearing from you guys. It's the way that I got connected with Vic, and we saw the wonderful connections and information we were able to get from that. So again, thank you, Vic, and thank you to all of you. I hope you have a wonderful rest of your day.